to ABC-7 at 4. I'm Nicole Gomez, and joining us now is Dr. Alozi of Sunset West. Now, we do know that May is National Women's Health Month, and this week we are celebrating National Women's Health Week. We also know that 13.4% of women in America over the age of 18 are in poor health. So, Doc, what are some of the leading causes of death in women?
Well, I think it's the usual suspects, right? When we talk about health, and it is important to focus on women's health, it's a little bit different than men's health. We talk about heart disease, cancer, and lung disease. I think what's really important here is that a lot of these are driven by the fact that a lot of women smoke, right? And actually those percentages are going up over the last decade, unfortunately, and a lot of it is driven by obesity. And we talk about obesity here a lot. The less you weigh long term, the better your health outcomes are.
And we also know that 19.8%, I should say, of women over the age of 18 have had at least one heavy drinking day. Hey, we get stressed sometimes.
Are you one of those 19.8?
No, I'm not. Let's
Okay.
talk about some of other concerns like hypertension, ovarian cancer, and breast cancer.
Absolutely. So I think the good news here is that it's interesting. If you look at the Kaiser Foundation's numbers from 2022, 90% of women below the age of 60 actually have health insurance. A lot of that is Obamacare, some is Medicaid, some is commercial insurance. But why that's important is that when you do have hypertension, or we do get some of the screenings that we'll talk about later, those things all need to go together. I think it's also important when we talk about breast cancer and heart disease, which we talked about before, a lot of those are about interaction with a healthcare professional, because a lot of these things are preventable. And if they're preventable, you can get ahead of them.
Okay, refresh our memory on preventative care.
Yeah, so I think I'll walk through this. One of the things that I do encourage everybody to do, male or female, is have a relationship with a primary care provider. That person is your navigator. They're the captain of your healthcare boat, and using another term, and they can get you where you need to be. Now, I actually think that the immunizations part should go below 20. We've talked about HPV before and how important it is to get an HPV vaccine. That's drastically reduced the rates of HPV and cervical cancer. And again, health and mental health awareness is critical. Now, when you get into your 40s, we're going to talk about breast cancer, talk about a lot of screening. But again, these are all the things that a primary care provider can get you in charge of.
Okay, where can we find helpful resources?
Well, before we get to the helpful resources, as we get older and you get into your 50s like me, right, we talk about things like a colon cancer screening. You want to talk about bone screening, right? One of the things that people don't realize is you get older, if you have a hip fracture as an older female, you have almost an 80% chance of mortality after a hip fracture. So it's really important to know your bone density. And at all ages, sleep well, don't smoke, get exercise, enjoy the sun. We're in the perfect environment for that.
Well, I see why you didn't want to skip the resources.
And again, the resources are the resources here. Shout out to Her Health, right? They're a female OBGYN group. I think, again, for women, sometimes they don't have a primary care or family care physician, but they go to their OB. And I think that's fine because they're critical and they're really important in that piece. There are resources across our community. Take advantage of them.
Yeah, and your OBGYN, your doctors already know your history.
Exactly, they know who you are.
That's right. And if you have a question for Dr. Alozi, just send us an email at news@kvie.com. Any questions? We haven't gotten one question.
Because we've answered all the questions on air.
You're right.
So people don't want to ask any more questions.
Okay, well, I'm sure you have a question out there, so please shoot us an email. Doc, thanks as always.
Thank you, appreciate it.